Welcome to Baby Care Month 2. You've made it! Your baby is now in his or her second month of life. During that first month of life, many changes have occurred, from rapid development to sleep and eating changes. Over this last month, you have learned what your baby needs and gained confidence in caring for your son or daughter. But they are changing rapidly again as they head into month 2. Your baby's development, nutritional needs, and schedules will change yet again. We are here to help guide you and provide information on how to continue to confidently nourish and support your baby's growth and development through food, sleep, and emotional well-being. This module will address the following topics and questions. The importance of bonding with baby. How often should my baby sleep? How much and how frequent should my baby eat now? Bottle feeding information, such as recommended nipple size, pace feeding, and nipple confusion. And is my baby getting enough adequate vitamin D? The importance of bonding with baby. First, let's discuss how fostering a bond with your child is a vital piece to their growth and development. A bond is formed between parents and their baby when they become a trusted person in their baby's lives. This can develop by responding to your newborn's needs with a smile, a caring touch, a cuddle, and love. When you as the parent provide these affectionate responses, your baby feels safe in the world, so they will more readily play, learn, and explore. Scientists are still learning about bonding and how it affects an infant's development. But they have discovered that the first model for intimate relationships is the strong bonds between a parent and their baby. This relationship can foster a sense of security and positive self-esteem and can be the foundation of your baby's emotional well-being and ability to cope with setbacks later in life. Bonding with your baby can also help their mental and physical growth. Cuddling, singing, talking, gazing, and touching your baby causes their brain to release hormones and chemicals that encourage brain growth, which leads to the development of language, thought, and memory. When it comes to bonding with your infant, most are ready to bond immediately after birth. But you may have a mixture of feelings, from an intense attachment immediately after they are born to one that develops over time. Bonding does not have to be limited to that time immediately after birth, but is a process and can happen over the course of time and can be a byproduct of daily care. Generally, the main caregiver, us mothers, develop a strong bond with our baby, but really, anyone who provides regular care and spends time with our infant can build a bond with them. This is especially important for those who will be helping mother during the first few months of baby's life. Some fathers may struggle with this since mother is the main caregiver. To help bond with your baby, there are several things you and your family can do. First, provide skin-to-skin contact during feedings or just when cuddling at home to help them feel secure. Second, respond to their cry. You can't spoil a newborn baby by giving them too much attention. Crying is their only way to communicate with you that they are hungry, need a diaper change, or are tired. Third, learn to read your baby's cues and signals. Think back to the first module and remember the visible hunger cues discussed. Learning these cues can help you respond to and anticipate your baby's needs. Later in this module, we'll discuss signs and cues of sleepiness as well. Fourth, talk to and sing to your baby. This helps soothe them and exposes them to words and sounds which may help their speech develop. And finally, stimulate your baby's sense of touch. Allow them to explore the different textures of dad's face, rub their face, hands or feet, which could help soothe them and create a bond between them and the caregiver. How often should my baby be sleeping? Further development and growth occur while your baby is sleeping, and the primary activity of the brain during early development is sleep. Sleep is a highly dynamic developmental process that every living creature needs. Research has found a positive association between adequate sleep and the development of memory, language, and overall cognitive development. Some studies also suggest that infants that get less than 12 hours of sleep per day may have a higher body mass index or be more prone to weight gain or have obesity later in life. Keep in mind that at this point in your baby's life, sleep will take up most of their time. For babies under 3 months old, the National Sleep Foundation recommends a daily sleep duration of 14 to 17 hours. This means that their awake time may vary from 7 to 10 hours per day. While they should sleep most of the day, this will not occur in one long stretch of time, but rather over short, irregular bouts of about 2 to 4 hour stretches. This is often due to their feeding schedules as well as their circadian rhythm or sleep-wake cycle not yet being developed. The circadian rhythm develops over time with exposure to light and darkness, so this rhythm does not start to develop until about 6 weeks old. During this second month of your baby's life, you may start to notice that your child's sleep time shifting more towards the night and less in the day. To help encourage this daytime wakefulness, play with your child in a brightly lit and noisy area. As nighttime approaches, encourage a calm, dark, quiet atmosphere to signal it's time for bed. Also stay aware of your baby's signals that they are tired. Putting to sleep an overly exhausted baby can be a challenge. Some signs of sleepiness may include, but are not limited to, fussiness, crying, rubbing their eyes, looking away, and yawning. When you notice these signs in your child, consider putting them to sleep. For more information on a sleep routine, check out the Healthy Sleeping Habits handout that came with this module. How much and how often should my baby be eating now? As mentioned, your baby's feeding schedule is one of the reasons they do not sleep for long stretches at this age. It is recommended that babies younger than 3 months eat every 2 to 4 hours on demand during a 24-hour period. So, this means your baby will still need both day and night feedings. Breastfeeding during the night has been shown to promote sleep in babies. Research has found that the sucking motion releases the hormone cholecystokinin, CCK, in you and your baby, which may result in a sleepy feeling. In addition, breast milk is said to contain hormones, amino acids, and nucleotides, which promote sleep and may help with developing your baby's circadian rhythm. If your baby is bottle fed, don't fret, as most research shows that formula-fed and breastfed babies have similar sleep patterns in their first months of life. One study found that mothers of breastfed versus bottle-fed babies had the same number of awake hours during the night. Remember, it is natural and normal for your baby to be awake at night and sleep in short stretches during these first few months of life. Not only are they working to develop the circadian rhythm, but they are also developing their digestive and nervous systems, so small, frequent feedings are easier on their system. In the past, you may have heard that adding cereal or extra formula to their nighttime bottle helps the baby sleep longer, but research has shown that it has no impact on sleep length and it goes against their natural feeding and sleeping pattern. The American Academy of Pediatrics does not recommend adding cereal to your baby's bottle to help improve sleep because it may promote weight gain and become a choking hazard. For this reason, adding anything to your baby's bottle before bedtime is not recommended. Keeping baby on a regular feeding schedule between sleep is the best approach. When it comes to your baby's eating habits, they will vary from baby to baby and be driven by the baby's need for nourishment and comfort. In general, your baby should nurse or be fed formula a total of 6 to 12 times a day. Watch out for your baby's signs of hunger. If your son or daughter still appears to want to suck and they have just been fed, consider a pacifier, as this may help soothe them. Sucking is a reflex that all babies are born with, and it is an innate trait that helps baby eat and drink. The act of sucking can have a soothing and calming effect, which is why you see many parents utilizing the pacifier. Keep in mind that while the pacifier can be a helpful tool, it should not be used to replace or delay meals. We also want to be cautious of nipple confusion or preference in a breastfed baby. Pacifiers should not be used until after 3 to 4 weeks of nursing. Some lactation consultants even recommend waiting until baby is well past 6 weeks so they can develop a strong latch and help mom's milk supply become well established. This stands true for bottle feeding a breastfed baby as well. It is recommended that the bottle be introduced shortly before you turn to work, since a baby who accepts the bottle early may still refuse a bottle as they get older. Delaying the introduction of the bottle also allows for the mother's milk supply to be fully established before an artificial nipple is introduced. A baby who adjusts to the rapid flow of a bottle before breastfeeding is well established may find it difficult to nurse effectively and prefer the quick response. Waiting to introduce the bottle once nursing is well established as the best practice. However, if you experience issues such as oversupply, undersupply, or raw, chafed nipples and need to pump and feed baby beyond the breast, some strategies to consider that avoid nipple confusion include a nipple shield, syringe, cup, or dropper to feed your baby. For a more personalized approach, be sure to speak with your NutriVantage lactation consultant. If these are not an option and the bottle needs to be introduced early, then a fed, nourished, happy baby is the most important thing above all else. Bottle feed information, such as recommended nipple size, pace feeding, and nipple confusion. When introducing the bottle at this stage, there are some strategies that can be put in place to help bottle feeding mimic nursing. Keep in mind, the tips we are about to discuss can also be used for a formula-fed baby and may help baby eat slower and prevent overfeeding. This is important because one study showed that babies fed by bottle, whether the contents were breast milk or formula, tend to gain too much weight. To help bottle feeding mimic nursing, you'll want to pick a bottle with the correct flow rate, nipple, teat shape, and slope or nipple tip shape. First, let's discuss milk flow rate. This is the rate at which milk moves from the bottle nipple into the infant's mouth during bottle feeding. Nursing is generally a slow process where your baby will need to actively suck to cause your milk to let down before they can begin to receive a flow of breast milk. Choosing a slow nipple can help mimic this. Studies have found that flow rates vary between brands. For example, one study found that flow rates varied across brands from 1.68 milliliters a minute up to 30 milliliters a minute. The 3 slowest flow nipples were the 0+ months Avent Natural Newborn Flow at 1.68 milliliters a minute, the Playtex 0 to 3 month Vent Air Wide Slow Flow Nipple at 4.90 milliliters a minute, and the Parent's Choice 0 months Standard Slow Flow Nipple at 6.53 milliliters a minute. Keep in mind that if the milk is dripping from your baby's mouth while bottle feeding, they may not be latched deep enough on the nipple, or the flow may be too much for them. Second, when it comes to the nipple size, look for ones that gradually change in shape. This promotes a deeper latch and will help prevent air pockets. Avoid bottle nipples that have small nipple and wide base, as this promotes air pockets or the baby sucking on the nipple like a straw. When introducing the bottle, it is recommended that you pace feed your baby. Please refer to Baby Care Month 1, Module 1 for details on pace feeding. Utilize this technique when feeding baby to help slow down the rate at which your baby eats and help to mimic a nursing session. When bottle feeding your baby, it should take them 10 to 20 minutes to consume their bottle. Take pauses between drinks and have baby sit upright to help slow down their consumption of milk. When introducing the bottle for the first time, make sure baby is happy, relaxed, and not overly tired. Consider having another caregiver provide the bottle to your baby because oftentimes breastfed babies will not accept a bottle from their mothers. To help your baby latch naturally, do not force the nipple into their mouth, but rather brush it from nose to lip. For challenges or concerns related to bottle feeding, we recommend a one-on-one consultation with your NutriVantage Mom's dietitian. At 1 month, your baby should be consuming 4 to 5 ounces of formula 5 to 6 times per day. This amount will increase by 1 ounce per month until your baby reaches 7 to 8 ounces. This is to meet the increased calorie and nutrition needs of your baby. In general, your baby should consume 2.5 ounces of formula for every pound of body weight. So, if your child weighs 8 pounds, he or she will consume an average of 20 ounces per day. It is recommended that you do not feed your baby more than 32 ounces in one day. If your baby still appears hungry after 32 ounces is given over a day's time, it is recommended that you consult your pediatrician and consider pace feeding and the other techniques discussed earlier. Your baby will regulate his or her intake by showing signs of hunger or signs of satisfaction. Watch for cues that baby is no longer hungry, such as fidgeting with the bottle, turning away from the bottle, or getting easily distracted. Do not force your baby to finish a bottle if they are displaying these signals. When it comes to breast milk, research has found that between month 1 and 6, that breastfed babies average 25 ounces of breast milk per day. Like formula feeding, different babies will consume different amounts of milk at one feeding, but a typical range can be anywhere from 3 to 4 ounces per feeding at 4 to 6 weeks old. Unlike a formula-fed baby, this amount does not increase, but rather stays steady until solid foods are introduced, when ounces per feed start to decrease. Trying to estimate a breastfed baby's intake using the same method used for formula-fed babies has been shown through research to overestimate the amount of milk baby actually needs. Why does a breastfed baby not need an increase in ounces per feed? This is all due to the dynamic changes that occur in breast milk from each feeding, which may allow the same amount of milk to meet your baby's growing nutritional needs. Generally, at this time, if you are breastfeeding, your milk supply is being established and starting to regulate. You may start to notice your breasts won't feel as full or hard. This is not a sign of your supply dropping, but rather a sign of breast milk regulation. If you notice your breasts are often very full and hard, even after a feeding, this may be a sign of oversupply. Oversupply can lead to many complications during nursing, such as an overactive letdown that baby can't keep up with, or hard breasts that make it difficult for your baby to latch. Hand expressing, pumping a small amount of milk, or reverse compressions prior to nursing may help to soften the tissue and allow for a proper latch. Oversupply may also lead to a shallow latch, which may cause nipple pain or soreness for you. A painful letdown, blocked ducts, and mastitis may also be side effects of oversupply. Be sure to avoid overpumping or expressing too much milk prior to nursing, as this may perpetuate your oversupply issue because breast milk is created based on supply and demand. The more your baby nurses and removes milk, the more your body produces. If you are struggling with the opposite and have an undersupply of breast milk, nursing baby as often as you are able to can help increase your supply. Putting baby to breast often is the best way to enhance milk supply. Pumping breast milk can be useful for many reasons, but keep in mind that pumping too often beyond feeding may cause oversupply. Many mothers can pump between feeding their baby to help build up a freezer stash before going to work. Keep in mind that a huge freezer stash is not necessary. You only need enough milk to get you through the first day or two back to work. You should be able to use the pumped milk from the previous session the next day. Feeding your baby before the freezer is most important. If you are unable to pump enough, this could be due to old or too large of pump parts. For more details on pumping, refer to Mom Care Month 3, Module 3. For more information on milk supply, refer to the handout, Building a Better Milk Supply. Is my baby getting enough vitamin D? Now that we've discussed recommendations for formula and milk consumption, let's take a closer look at vitamin D, a nutrient that your baby may not get adequate amounts of. Adequate vitamin D is vital to your baby's skeletal system because insufficient intake may lead to rickets. Rickets can cause soft bones and skeletal deformities such as bowed legs, thick wrists and ankles, and a projected breastbone. It is also important for their immune systems because it helps to regulate infection. Vitamin D is considered the sunshine vitamin because when our skin is exposed to sunlight, our body makes vitamin D. Sunlight and food such as cod liver oil, fish like mackerel, tuna, and salmon, egg yolk, beef liver, and fortified dairy products can help provide your body with vitamin D. However, since your baby's sole source of nutrition should be either formula or breast milk at this time, they may be at risk for vitamin D deficiency, especially if you have limited exposure to sunlight or your baby has darker skin pigment. A darker skin pigment means your baby will require more sun exposure to make adequate amounts of vitamin D. When it comes to sun exposure, although it can provide our bodies with adequate vitamin D, we want to keep in mind that too long in the sun can lead to sunburn, which should be avoided in young infants. Since 2008, the American Academy of Pediatrics has recommended that infants and children consume 400 IUs of vitamin D per day. For formula-fed infants, it's important to note that most formula contains 400 IUs of vitamin D per serving, so if your baby is consuming at least 32 ounces of formula each day, they do not need to be supplemented. When it comes to an exclusively breastfed baby, it has been found that they are at an increased risk of developing rickets due to a vitamin D deficiency. This is because a normal lactating women's milk is known to only contain 5 to 80 IUs of vitamin D. That's more than 300 IUs below the recommended intake. This is not a flaw in breast milk, but rather a result of the mother's deficiency. Research has found that mothers who consume at least 6,400 IUs of vitamin D per day can transfer adequate D to their baby through breast milk, while the Institute of Medicine has set the upper limit to 4,000 IUs of vitamin D. The Endocrine Society guidelines indicate that 10,000 IU per day is safe. Dr. Hollis, a researcher and the director of pediatric nutritional science at the Medical University of South Carolina, states that he has not come across a single adverse event due to vitamin D intakes above 4,000 IUs during the trials he has been a part of. These trials have involved tens of thousands of patients, and again, not one adverse event has been due to vitamin D intake. This option is a nice alternative to the liquid vitamin D supplements often given to young infants, as many have a hard time tolerating them digestively, so enhancing your breast milk through supplementation is a nice alternative option. If breastfeeding, discuss supplementation with your physician and begin to incorporate vitamin D supplements soon after your baby is born. If the pediatrician does not mention vitamin D supplementation at your baby's first visit, then you can bring it up on your own or be sure to mention it at their next visit.